Hello everyone, how are you all? Let's continue the pathology PYQ discussion 2023 paper. Yes, the most specific indicator of alcohol induced liver dysfunction is. Yes, when we see this question, we will slightly get confused, but the most specific indicator when there is an increase in one of the enzyme, you can just predict that he might have got a alcohol induced liver dysfunction, which is that is GGT. Okay, sometimes we will get confused SGPT because SGPT is increased more than SGOT. We will consider this as a alcohol liver disease, but the most specific indicator is GGT. Let me show you. See, most specific indicator for alcohol-induced liver dysfunction is gamma-glutamyl transferase, that is GGT. Okay, here you have to see this picture once. See, SGPT is nothing but a ALT, SGOT is nothing but AST. Here you can remember this AST is for OT. AST is, let's consider anesthesia OT. Okay, AST is for OT. These two are same. Sometimes they might interchangeably use this. Okay, but when AST is increased, it might not be a specific thing to the liver. Okay, it might be increased in some other diseases also. In the gallbladder, you can get ALP and GGT. Yes, this was the GGT we saw, which is increased in the excessive alcohol intake. But these two can be increased in biliary diseases and gallbladder diseases. But ALP is not specific for gallbladder. It can be increased in other diseases also. Likewise, you can see the pancreas, which has a amylase and lipase. Amylase is present in the saliva also, isn't it? So amylase is also a non-specific marker. Okay, first let's see, when there is a lab investigations in a patient with alcohol induced liver dysfunction, you can get a AST done, ALT done, but the increase will be there, but it will not exceed more than 400 international unit. The normal you can take up to 35 international unit to 40 international unit. It's okay when there is increase, but it is not exceeding the 400 international unit. You can consider there might be alcohol induced liver disease. Okay, and AST by ALT ratio is more than 2. This is the one thing you have to remember in alcohol liver disease, because sometimes in the question they will give AST and ALT. When AST is more than ALT, you can suspect that is a liver disease. Okay, the serum bilirubin is more than 3 gram per deciliter. Yes, see, in all the hepatic diseases, you can expect ALT is more than AST, but in alcohol-induced hepatitis, there will be AST is more than ALT. Okay, here I have given some of the clinical cases, even though I would have explained in 20th book, but I thought of putting here only. Just let's glance through it. AST more than ALT, if it is less than 400 international unit, yes, we can suspect alcohol steatohepatitis. Yes, both ALT and AST are increased between 400 to 4000. You can suspect hepatitis, that is viral hepatitis, hepatitis B. Yes, when there is ALT is more than AST, more than 10,000 international unit, you can suspect acetaminophen toxicity, that is paracetamol toxicity, poisoning. Whereas increasing GGT, you can suspect in the alcohol liver disease. Yes, when ALT is normal but AST is increased, we have seen here AST is a non-specific, hence it can be extra hepatic cause. Okay, when there is hepatic cause, both has to be increased, not just AST. Okay, when GGT is normal, ALP is increased. See, GGT is normal, ALP is increased, then it is extra biliary or extra hepatic. That example is bone, that is increased osteoblastic activity. And when there is increase in bilirubin, ALP, amylase, lipase, you can suspect biliary pancreatitis. Yes, these things you should remember. This all things will help you in solving medicine question. Okay. Hence answer is B. Coming to the 12th one, which of the following statement is true about blood products? Okay. For this question, first let's see the explanation once, then let's come here and solve it. Okay. See, in the blood bank, they will use a anticoagulants. Okay, depending on the anticoagulants also you have a different shelf life. What is ACD? Acid citrate dextrose. CPD is citrate phosphate dextrose. CPDA is extra one adenosine will come. Yes, AGM will have a saline adenosine glucose mannitol. It has a highest shelf life, that is 42 days. Other all anticoagulants have a less, that is CDPA has 35 days, CDP has 21 days, and ACD has a 21 days. Yes. Now let's see whole blood components. Okay. When the red blood cell or a whole blood is used, the temperature you store is 2 to 6 degrees Celsius. Okay. The shelf life depends on the anticoagulants used. Yes. The SAGM, when used 42 days, and uses acute blood loss, severe anemia, 1 unit will increase the hemoglobin by 1 gram. Okay, when platelet is the component, you will store in the 20 to 24 degrees Celsius, which is near to the room temperature. When you store something in the room temperature, you can't store it for a long time, isn't it? So 5 days. When you can use this thrombocytopenia, 1 unit of platelet can increase by 10,000 mm of cube. Yes, the fresh frozen plasma FFP, which is stored in a minus 18 to minus 30 degrees Celsius. Yes, it is stored up to minus 30 degrees Celsius. Okay, cryoprecipitate also same thing, which is both have a same thing. Okay, which is a shelf life of 1 year. Okay, but the fresh frozen plasma is used in the multiple coagulation factor deficiencies, DICs, liver disease. Yes, why? Because it contains almost all the multiple coagulation factors, whereas cryoprecipitate does not have a factor 9, hence it cannot be used in Christmas disease. This is also a question, that is hemophilia B you can't use cryoprecipitate, but in hemophilia A you can use, and von Willebrand factor deficiency also you can use. Okay, because von Willebrand deficiency is related to the factor 8, because von Willebrand factor helps in stabilizing the factor 8. So cryoprecipitate can be used, but hemophilia B you can't use cryoprecipitate. Okay, hence let's see the options. This is the important question, but when you see the question with options, you will be like, oh my god, I am not poor with the numbers, how can I remember? But if you have visited your blood bank at least once in your internship, you might have seen the platelets are kept in the room temperature. Okay, yes, platelet is stored between 20 degrees Celsius to 24 degrees Celsius. Yes, this is near to the room temperature. Yes, they are kept there. And when you keep something outside, how many days the shelf life can be? Of up to, you can expect 5 days. Yes, correct. Cryoprecipitate is stored at minus 20 degrees Celsius with a shelf life of 6 months. Cryoprecipitate and fresh frozen plasma for 1 year. See, fresh frozen plasma 2 years and cryoprecipitate 6 months. This can be ruled out. But what is the temperature that you can store up to? It is minus 30 degrees Celsius. Okay. Here also they have given minus 5 degrees Celsius to 15 degrees Celsius. This is also wrong. Okay. Packed red cell stored with the adenine glucose mannitol and saline, that is SAGM, stored between minus 5 degrees Celsius to minus 15 degrees Celsius with a shelf life of 5 weeks. Is it stored with the minus 5 degrees Celsius? No, right? It is a 2 to 6 degree Celsius. You can store it. Shelf life is maximum when you store in this, how many days? 42 days. 42 days means 5 weeks? No, right? Each month has a 4 weeks. Okay. So 5 weeks means 30 days plus 37 days. Okay, but 5 weeks is 37 days, but you can store up to in this 42 days, which is also wrong. Okay, so only correct option is A. Coming to the 13th one, a woman presented with a fixed nodule in her breast with nipple retraction. The biopsy shows her to new positivity. What chromosome is responsible for brown color in the immunohistochemical stain? If you have seen the immunohistochemical stain, the cell wall will be positive in the HER2 new positivity. Which, because of which chemical? It is because of diaminobenzidine. See, the 3,3 diaminobenzidine is a chromosome that is used for immunohistochemistry when exposed to the hydrogen peroxide and horseradish peroxidase. It produces brown precipitate. Okay, you can remember diaminobenzidine, benzidine for brown, BN. Yes. Okay, let's coming to the 14th question. Identify the mode of inheritance from the pedigree chart given below. What is this? Actually, this is the easy question and important question, but many of them will make a mistake. Can you see? The males got affected, and the next generation, half of the population are getting affected. And again, when female got affected, both her childs are getting affected. Yes, males also both are affected. What is this? There is no skip of generation, hence it is not a recessive disease. Option B is wrong. Pseudo-dominant inheritance, no. Incomplete penetrance also, no. There is complete penetrance only. You can see the diseases, isn't it? So it is a autosomal dominant disease. See, this is the easy method to know the inheritance. First, you have to see, does the affected individual have a multiple generation affected? Okay. If yes, then it is dominant. That means you can just remember if there is a generation skip or not. Here you can see there is a no generation skip. The directly all the generation are getting affected, isn't it? So you have to see generation skip is there or not. If yes, then it is recessive. Okay. If there is no generation skip, then it is dominant. First, let's see the recessive. All affected individuals are males. What does that imply? It is X-linked recessive. If nothing like that, the male, female, anyone are getting affected, then it is autosomal recessive. When there is a dominant, okay, if there is a male to male transmission noted, yes, that means it is a autosomal dominant, because in the X-linked dominant, father will give a disease to the female child, because the X chromosome for a male is given by the mother, okay, not the father. Hence, the male to male transmission is noted, then it is autosomal dominant. Okay, in X-linked dominant, you can't see male to male because that X is not given by father, it is given by mother. Okay. Yes, I think you understood this question, autosomal dominant. Coming to the 15th one, which of the following statements is true regarding the immunological abnormality that is seen with lack of CD40 in B cell? Okay, what is the immunological abnormality seen when there is CD40 is lacking in the B cell? Can you tell me? That is decrease in IgG and increase in IgM. See, that is lack in CD40 in B cell is called as hyper IgM syndrome. That is IgG decreases, IgM increases. The deficiency of CD40 interferes with class switching and production of memory cell. There will be problem with the class switching, and also there is production of the memory cell will get hampered. B cell response to the antigen is unaffected because of increase in IgM. B cell will respond to the antigen, okay, but only affected is this thing, okay. And recurrent pyogenic infection because of low levels of opsonizing IgG antibody, because IgG will help in opsonizing, isn't it? That it gives a taste for the antigen so that the antibodies can eat it nicely. Okay, that will be hampered because of decrease in IgG, but the B cell response will not get affected. What is this called as? Hyper IgM syndrome, when there is lack of CD40 in B cell. Okay. 16th one, the most common cause of adrenal incidentaloma is the incidentaloma. That means incidentally you are finding it, isn't it? So it might be something non-functioning adenoma. You can remember this. Okay. I have not given anything. Okay, the most common adrenal incidentaloma is non-functioning adenoma, less than 4 centimeter. You have to do conservative management. MRI surveillance can be done for 3 to 6 months gap. But if it is more than 4 centimeter, you can do laparoscopic adrenalectomy. Coming to the 17th one, the B cells expresses IgM and IgD antibodies at same time, due to which phenomenon? The B cell expresses IgM and IgD antibody. Why? At the same time. Why? Because of alternative RNA splicing. Let me show you. This is the picture I only have drawn just to visual memory. Okay. This is the RNA transcript. The splicing in the different ways. Okay. See, alternative splicing will take place. This splicing is taken place here, here, here. It's here, here, and here. So different ways of splicing will take place. One will become IgM, one will become IgD. B cell expresses IgM and IgD antibodies at same time due to alternative RNA splicing. So answer is B. Okay, enough for today. Take care everyone. Don't worry about the exams. Everything will go smooth. Okay. How much ever you know, that is not an issue. Be confident while answering.